Cholinesterase inhibitor poisoning. This is an incredibly high-yield topic because it incorporates autonomic nervous system pathophysiology with a rather unique clinical vignette. So be on the lookout for a farmer or anyone found down near a barn or storage house that might have insecticides inside. Insecticides such as parathione and malathione kill insects by the same mechanism that it also kills people: irreversible inhibition of the acetylcholinesterase enzyme. This causes dangerous increases in both the level and duration of action of acetylcholine. These poisons can be easily absorbed in the skin, lungs, and oral mucosa, so significant exposure can happen without a patient even realizing it. This is actually also the mechanism of nerve gas, which is a weapon of mass destruction. With an increase in acetylcholine in the synaptic cleft, what receptors would we expect to be affected? That's right, our muscarinic receptors in the parasympathetic pathway. Some in the sympathetic pathway, as well as our nicotinic receptors found at the neuromuscular junction. Knowing which receptors are affected will help us recognize the signs and symptoms of insecticide poisoning. So starting at the top of the body, excessive amounts of acetylcholine in the brain stimulates M1 receptors, which results in agitation, confusion, coma, and seizures. In the heart, stimulation of our M2 receptors will cause bradycardia. Do you remember what G protein is coupled to the M2 receptor? That's right, our GI or G inhibitory. Remember our MAD2s. And what intracellular process occurs after stimulating the M2 receptors? Activation of the GI subunit causes inhibition of adenyl cyclase and a decrease in the conversion of ATP to cyclic AMP. As a result, protein kinase A is not activated, leading to no increase in the amount of intracellular calcium in cardiac myocytes. Now, what does a decrease in intracellular calcium do to our heart rate and cardiac output? Both decrease significantly, which is why bradycardia is classically seen in a patient with insecticide poisoning. Looking at the rest of the body, stimulation of M3 receptors on the pupillary sphincter muscle, bronchioles, intestine, and bladder results in smooth muscle contraction, which presents with meiosis, bronchospasm, diarrhea, and urination. What does stimulation of M3 receptors on exocrine glands such as the lacrimal and salivary glands lead to? Well, it leads to lacrimation and salivation. So far, we have seen that cholinesterase inhibitor poisoning will lead to overstimulation of our parasympathetic pathways. However, let me ask you this. Would you expect a patient with insecticide poisoning to be sweating? Yes! Even though sweating is part of a sympathetic pathway, we have M3 receptors on our sweat glands, and therefore acetylcholine will act upon them. Lastly, activation of nicotinic receptors on the neuromuscular junction will stimulate muscle contractions, leading to fasciculations, weakness, or even paralysis. Now, what's an important muscle we use all the time that you do not want to be overworked and potentially paralyzed? That's right, our diaphragm. Okay, so what is the treatment for cholinesterase inhibitor poisoning? If you catch it early, you can give pralidoxime, aka 2-PAM, which essentially pulls off the organophosphate from the acetylcholinesterase. Or you can give atropine, which competes with acetylcholine and muscarinic receptors. We will speak more about atropine in another lecture. A cool mnemonic to remember the signs of insecticide poisoning is dumbbells. Basically, if a patient is poisoned, then they will be leaking everywhere and won't be able to see or breathe. D for diarrhea, U for urination, M for meiosis, B for bradycardia, another B for bronchospasm, E for emesis, L for lacrimation, S for salivation, and the last S for sweating.